Why are you here? Let's go, first aid class.
Hi to everyone. We meet again. My name is Dr. Tan from St. John Ambulance of Malaysia, State of Penang. Today, we will be covering a new chapter which is on bones, joints and muscles. On the last chapter, we have covered shock and bleeding. Shock and bleeding is important because in this coming chapter, when a person sustains a fracture of the bone,
oh my god, that is so bad. Bro, his leg, look at his knee.
It may also possibly lead to a lot of bleeding and eventually may lead to possible hypovolemic shock. Before we go to the actual topic, I would like to introduce you to some new terminologies, which are the skeleton, the muscles, the bones, ligaments, tendons, and etc. We'll start out with skeleton. What is a skeleton? Skeleton is actually a bony framework of our body that provides support to our body. It also supports the muscles, ligaments, and tendons. It protects our vital organs, and it also at places of the joint where the bone articulates, movement of the ligament, bones, muscles, and the tendon that attach to the bones makes movement of the joint possible. Our skeleton is made up of 206 bones. Generally, it can be divided into a few major bones. Some are fused together, some are individual. We have the skull, connected to the spine and the pelvis. And in between, we have the rib cage, which protects our lungs. Our skull is a round-shaped bony structure covering our head. It is where the brain lies. The skull is formed from fusion of multiple bones over the scalp area, where the cranium is the dome of it. It consists also of multiple bones that forms the eye socket, the nasal bone, and the jaw bone as well. The skull protects our brain, where the brain is protected and supported by the cranium, and it travels along the spinal cord towards the upper limb and the lower limb. The spine connects our skull to the pelvis area. The spine offers protection to the spinal cord, which is an extension of the brain traveling down towards the upper limb and the lower limb. What does the spine do? The spine offers support to the body, mainly the upper body. It also offers flexibility and extension of the spine, which is the rib cage. It offers protection to the vital organs such as the lungs and the heart. When we are performing CPR or when we are performing chest compression, we place our hand at the center of the chest, which is at the sternum area. We compress the sternum, which indirectly compresses the rib cage, and it will compress the underlying heart, offering external compression. When the heart is compressed, it will artificially pump blood to reach the vital organs. Our spine consists of multiple small bones, which are called vertebrae. To be exact, it consists of 33 vertebrae, which is connected by a fibrous intervertebral disc. This intervertebral disc forms a cushion between the vertebrae, and it offers flexibility and support for the body. We will proceed to the bones of the upper limbs and the lower limbs. On the upper limbs, we have the humerus, which forms the upper arm and connected to the elbow joint, and proceed to the bones of the forearm, which are the radius and ulna. Then this will connect to the wrist joint, which consists of multiple small carpal bones, the metacarpal, and also the finger bones, which are called the phalanges. On bones of the lower limb, it comes out as an extension of the joint of the hip joint, started off with the femur bone, which is also the longest bone of the body. The femur bone is connected to the tibia and fibula, which are bones of the lower limb. It is connected to the feet via the ankle joint, or called a tarsal, and the metatarsal, and also the toes, which are called the phalanges as well. What is a joint? A joint is a place where two or more bones articulate. At the end of the joint normally are formed with ligaments or fibrous tissue. Joints can be divided into basically two: movable joint and immovable joint. Let me give you an example of immovable joint. Immovable joints, for example, are the skull and the pelvic area. The skull is formed by multiple bones which are fused together called sutures. They don't provide movement. Whereas movable joint, examples are our hinge joint. Hinge joint examples are at the elbows and at the knee. Our elbow joint, we only allow flexion and extension of the forearm. At the elbow joint, there are basically two groups of muscle connected to the joint via the tendon. We have the bicep muscles and the tricep muscles at the elbow joint. When the elbow flex, it is because of contraction of the bicep muscles. When the bicep muscles contract, the other muscles which is opposite to it, the tricep muscles, relaxes. And when the elbow extends, the tricep muscles contract and the bicep muscles relaxes. So this basically forms a hinge joint. For a ball and socket joint, it allows more movement of the joint in different angle. We have our shoulder, which can be moved in multiple directions, but it is also attached with very strong muscles and ligaments and tendons. There may also be possible injuries over the muscles and over the ligaments as well. This happens when the muscles or ligaments are overstretched, causing sprain, or in certain examples where there is severe contraction of the muscles causing cramps. We have further discussed it in a topic eventually. What is fracture? A fracture is a break or crack in the bone, which may be due to a direct or an indirect force.
Injury to bone or muscle can occur as a result of direct force, such as a blow from a baseball bat. The energy is, in this case, immediately transferred to the bone, causing a fracture. An indirect force transmits energy to a bone or muscle that is not in direct contact with the force. In this example, the energy from the direct impact of the shoulder striking the door is, in part, transferred through the shoulder girdle, indirectly causing the opposing shoulder to dislocate.
There are basically two types of fracture, which is an open fracture and a closed fracture. How do we differentiate them? An open fracture, you will see there may be a source of bleeding from an open wound. This normally happens when the fractured bone breaks and it creates a penetration to the tissue externally, hence permitting the bleeding out of the wound. In the case of a closed fracture, a fracture occurs where the bone breaks underlying the skin or underlying the tissue, but it doesn't go beyond the surface of the skin. It may cause surrounding injury such as hematoma or bruises over the surrounding tissue. That is a closed fracture.
Signs and symptoms of fracture. A casualty with fracture may have deformity, swelling, and bruises at the fractured site. He may complain of pain with difficulty in moving the affected area. There may also be shortening, bending, or abnormal twisting of a limb. Coarse grating, or better known as crepitus of the bone ends, can be heard or felt by the casualty. There may also be signs of shock, especially if the femur bone or pelvic bone are fractured. The casualty may have difficulty in moving a limb normally, and he may have inability to walk. There may be a wound, possibly with the bone protruding, which we call as an open fracture. For fracture of lower limbs, the aim is to prevent blood loss, movement, and infection at the site of the injury. If you see a casualty with suspected fracture of lower limbs, advise the casualty to keep still. Support the joints above and below the injured area with your hands, or ask a helper to do this until it is immobilized with a sling or bandages. Place sufficient padding around the injury for extra support. Move the uninjured leg to the injured one and secure with broad fold bandages. When you tie a broad fold bandage, always tie the knots on the uninjured side. For management of open fracture, firstly, cover the wound with a sterile dressing or a large, clean, non-fluffy pad. Advise pressure around the injury to control bleeding, but be careful not to press on the protruding bone. Immobilize the injured part with the uninjured leg. Lastly, arrange removal to the hospital with comfortable support during transport by calling 999 for emergency help. Always remember to wear gloves or the necessary personal protective equipment when we are dealing with the casualty. Management of fracture of the upper limbs. The aim is to immobilize the affected arm. Firstly, ask the casualty to sit down and remove all jewelries on the affected arm. Gently place the affected arm horizontally across the casualty's body in the position that is most comfortable to the casualty. Ask the casualty to support elbow for proper support. Support the arm and its padding in an arm sling, which can be an elevation sling or a large arm sling. For additional support, secure the arm by tying a broad fold bandage around the chest. Make sure that the broad fold bandage is below the fractured site. After that, arrange removal to the hospital by calling 999 or send the casualty to the hospital with the injured arm supported.
A joint is a place where two or more bones articulate and meet each other, allowing movement. Common areas of the joint include our shoulders, the knees, the ankle, the finger joints, and others. What happens in dislocated joint? In dislocated joint, it happens when a wrenching force or a severe muscle contraction occurs, pulling the joint or the bone out of its normal joint position. And this will be a possible very severe and painful condition.
Signs and symptoms of a dislocated joint. The casualty may complain of severe pain over the affected joint. He may have inability to move the affected joint. There may also be swelling and bruises around the affected joint. There may be shortening, bending, or deformity of the area as well. Management of dislocated joint. The aims are to prevent movement at the injury site and to arrange for removal to the hospital for further management. To prevent movement at the injury site, advise the casualty to keep still. Help him to support the injured arm in a position that he finds most comfortable. For a hand or arm injury, remove bracelet, rings and watches in case of swelling, and immobilize the injured arm with a sling. After that, arrange for removal of the patient or victim to the hospital. Do not raise an injured leg. Do not try to replace a dislocated bone into its socket, as this may cause further injury.
Our brain is an important organ in our body, and it is protected by our overlying skull. What happens in skull and brain injury? This happens may be due to significant force over the head and skull. The significant cause of force over the head and skull may potentially cause injury to the underlying brain. The underlying brain may be injured when there is a significant force to it. For example, in the case of concussion and compression. In concussion, it occurs when a significant force over the skull area, causing the underlying brain to shake. A casualty experiencing concussion may experience a brief unconsciousness, or sometimes upon waking up, he may experience brief forgetfulness or amnesia. In compression, this is normally a more severe condition where there may be a fractured skull over the skull or scalp area. This fractured bone particle may compress on the underlying brain, causing a raise in brain pressure. And most of the time, the patient or the casualty may present with loss of consciousness, he may be unresponsive, and he may present with other signs and symptoms of brain injury. There are also conditions where there may be minimal injury or minimal force causing the brain and skull injury. This normally does not cause injury to the brain, but the person will normally present with small bruises, scratch over the scalp area, but does not involve the brain.
Signs and symptoms of skull and head injuries. The casualty may present with a brief period of impaired response or unresponsiveness. There may be presence of a wound over the scalp area. He may present with dizziness or nausea. He may have loss of memory of the event at the time of injury or immediately preceding the injury. There may also be mild generalized headache, and he may appear confused. For severe head injury, there may also be a history of a severe blow to the head. The casualty may present with a deteriorating level of response, or he may present with loss of responsiveness. there will be leakage of blood or blood-stained watery fluid from the ears and nose. The casualty may also present with unequal pupil size. Management of skull and head injuries. For a casualty with skull and head injuries but still conscious, sit him down and give him a cold compress to hold against the injury. Carry out an assessment of the casualty's level of response using the AVPU scale. A first aider may treat any scalp wound by applying direct pressure to the wound, and regularly monitor and record his vital signs such as breathing rate, pulse, and level of response from time to time. Always keep the airway open. Ask the casualty to spit out any blood, displace teeth or dentures from his mouth. Keep any teeth to be sent to the hospital together with him. Obtain any medical help if necessary. Advise the casualty to seek help. For serious head injury, arrange urgent removal to the hospital. Call 999. Maintain an open airway and clear the airway. Do this in the position the casualty was found. Regularly monitor and record vital signs while on the way to the hospital.
Our spine supports our body and connects the head to the neck, upper back, and lower back. The main function of the spine also to protect the underlying spinal cord, which travels inside the vertebra, and along each vertebra there will be nerve segment branching out towards the body. In spinal injury, there may be significant injury or force injuring the spine, causing a person to sustain injury. A casualty that sustains spinal injury may present with loss of power or loss of sensation. For example, he may complain of unable to move the affected leg. He may complain of numbness over part of the feet area, or in worst case scenario, he may lose control over the bladder and unable to control his motion.
Signs and symptoms of spinal and neck injuries. The casualty will complain of pain in the neck or back at the injury site. There may be step or irregularity or twist in the normal curve of the spine. There may also be tenderness and bruising in the skin over the spine. When the spinal cord is damaged, the victim may complain of loss of control over the limbs, where movement may be weak or absent. There may also be loss of sensation or abnormal sensations such as burning or tingling sensation. There may be loss of bladder or bowel control, and he may also present having breathing difficulties. Management of spinal and neck injuries. The aim is to prevent further spinal damages. This can be done to support the casualty head and make sure that the head, trunk, and legs are in a straight line. Second aim is to maintain an open airway. Kneel or lie behind the casualty's head. Open the casualty's airway using jaw thrust technique, and ensure the casualty is breathing properly. If the casualty is breathing appropriately, continue to support the casualty's head. Place roll-up blankets on either side of the casualty's head while you keep the head in a neutral position. In the case where the casualty is not breathing, begin CPR. Arrange urgent removal to the hospital by calling 999.
Hip and thigh injuries may potentially cause serious complication to a casualty. Our femur bone is one of the strongest bone in our body. It needs significant amount of force to cause a femur fracture. When femur fracture occurs, the broken part of the bone may damage the surrounding tissue. It may also damage the vessels, causing losing of blood and causing hypovolemic shock. Femur fracture may also occur in elderly person when they have osteoporosis. In hip injuries, when there is a significant force against the hip area, it may cause hip dislocation. This may also be a potential complication for the casualty. When hip injuries happen, it may involve the pelvic area as well, causing pelvic injuries.
Signs and symptoms of hip and thigh injuries. The casualty will have pain at the site of the injury. He may have inability to walk. There may be presence of signs of shock. He also may have shortening of the leg and turning outward of the knee and foot. Management of hip and thigh injuries. The aims are to immobilize the limb and arrange for urgent removal to the hospital. Help the casualty to lie down and make him as comfortable as possible. Support the injured leg at the knees and ankle. Immobilize the leg by securing it to the uninjured one. Call 999 and send to hospital. Do not raise the casualty's leg.
Our bone and joints are protected by soft tissue, which consists of ligaments, tendons, and muscles. In sprain and strain, it happens when the ligaments or soft tissue are overstretched, causing complete or partial torn or tear, which may be due to a direct force or indirect injury to it. Sprain and strains normally occur during sporting activities such as running, jumping. Let me give you an example. A person who may be running accidentally twisted his ankle. He may be complaining of pain over the ankle region. Most likely he is suffering from a sprained ankle.
Signs and symptoms of strain and sprain. There may be pain and tenderness on the affected part. The casualty may have difficulty in moving the injured part, especially if it is involving a joint. There may be swelling and bruises over the area as well. Management for strain and sprain. To reduce swelling and pain by helping the casualty to sit down or lie down. Support the injured part in a comfortable position, preferably raised. Cool the area by applying a cold compress such as an ice pack. This will help to reduce swelling, bruises and pain. Apply comfortable support to the injured part. Secure it with a comfortable bandage. After that, check the circulation beyond the bandages. If the pain is severe, arrange or send the patient to the hospital. Strains and sprains can be treated by the RICE procedure. R for rest the injured part. I to apply ice pack. C to provide comfortable support. And E to elevate the injured part.
Another common cause of sport injuries is also cramp. Cramp is due to an involuntary contraction or spasm of a muscle or a group of muscles. Commonly occurs over muscles area, for example, in the calf, the thigh muscles, and also possibly the abdominal muscles. Common injury like cramp happens because of after strenuous exercise, there is accumulation of chemicals and there may be dehydration causing a person to lose salt. In a typical condition, such as in a marathon event, a person who has jogged for long distance and long duration, he may be losing salt, he may be dehydrated, hence after crossing the finishing line, he may suffer from cramp over the thighs or the calf areas. This can be easily managed by massaging the affected muscles and stretching the affected muscles. We have come to the end of our topic on bones, joints and muscles. We have covered the bones, the muscles, the ligaments, the tendons, the theory behind it. We have also covered what is fracture. There are two different types of fracture, open fracture and a closed fracture. We have covered fractures at various locations, mainly the arms, the pelvic, the lower limbs, head and skull injuries, etc. We have also covered some of the lesser serious sports injuries such as sprains, cramps, etc. We like to conclude that for managing of a fracture, we have to immobilize the fracture and control the bleeding if necessary. For a casualty presenting with cramps, sprains, remember the mnemonic RICE, where we rest the injured part, immobilize, apply cold compress, and elevate the affected part to prevent swelling. In any doubtful cases where if you are unsure whether this is a cramp, a strain, etc., always treat as a fracture where we immobilize the affected part. Our next topic will be on wounds, where we will elaborate further on management of wounds.